Hi everyone, Mabel here. In this video, I'm going to be demonstrating how to properly insert an IV, how to prime it, and how to discontinue it. I'm hoping that all of it will, be in one video. Um, I'm going to be using my husband's arm as an illustration. So let's get started. I'm going to put my stuff together, the stuff that I need. So let's go. So I have this as my extension tubing, my IV extension tubing. I'm going to be using this for that. And then I'm going to be using an IV start kit. And in the IV start kit, we have a tourniquet. I don't have it. So I'm going to be using this transparent tape as my tourniquet. And then I'm going to be using this as my alcohol wipes. I'm going to be using this as a regular tape. Next, I'm going to be using this as my tourniquet. And then I'm going to be using this ones as my gauze pads. And then I'll need a pair of gloves, a label. I'm going to be using that as my label. Normal saline. I'm just going to consider that there's saline in there. I'm going to be using this as my absorbent pad, just to place my client's arm on it in case of any blood splash. I'm going to be using this as my catheter with the syringe. And then I'm going to be using this as my, so this one is my catheter and the needle. And then this one will be my bulk syringe. So I now have my supplies. I'll get ready to go into my client's room. So I'll knock, get into the room, introduce myself, and let the client know that I'm here because I have an order to insert an IV. And then I'm going to wash my hands. I am going to provide privacy. Then I'll don my gloves. I'm going to put on my gloves. So as I put on my gloves, I'm going to explain the procedure to my client, how what is going to take. I'll explain to the client that I'll have to stick a needle into the skin to get to the vein for me to be able to properly insert this IV. So I'm going to ask before I start anything, I'm going to ask my client to identify themselves with the correct name and correct date of birth to make sure that I'm in the right client's room. And also, I'm going to ask my client if they had done this before and if they have any allergies to latex, because I think these gloves are latex. I'm going to ask if they have any allergies to latex, any cleansers, maybe like our alcohol wipes, or tape, like I do have here. So after that, I am going to, open my absorbent pad up and ask my client to place their hand. So we are using this just in case there's any blood spatter. And then I am going to look for the site. The site I'm looking for, I am trying as much as to avoid the veins, the joints, pardon me. So ask my client to make a fist. And then I'll apply my tourniquet about 4 to 6 inches above the area where I'll be using as my insertion site. So when I do that, now I'm going to palpate the vein. before I do this, or before I even choose the IV site, I'm going to make sure there is no rash on this side, there is no bruising, there is no swelling or any infiltration. So this is our side, it has none of that, so I'm going to go ahead. So I'm going to palpate the vein, and once I find it right here, I'm going to tap it a little bit so that it's visible. Once I get that, I'm going to get my alcohol wipes and wipe it forward and backward on the side, and I'll just let it air dry. I'll put this in the trash. I'm using this red bag as my trash and at the same time as my sharps container. So while I let it air dry, I am going to prime my IV tubing. So how I prime that is, this is my saline. I'm going to insert it. Say there was a lock here, so I have to open it up because we want to make sure everything is sterile. So I'm going to insert the saline into the IV tubing, and then since everything has to be locked, I'll be using this as my cover. Say it was covered like that, then I'll remove it and flush the IV tubing just a little bit. And when I see some saline come out of here, then I will just leave it like that, and then I'll cap it and place it there just to get it ready. That is why waiting for the IV site to get dry. And I'm going to also get my tape ready. So you know, tape and gloves do not go along. I'm going to prime it here. I'm going to put my tape right here so that it's ready when I need it. So remember I said I was going to use this transparent one as my tourniquet, while I'll use the paper tape as just a normal tape for the site. So place it at the edge of the table. I know that's a lot of tape. Okay. So now I'm going to get my needle with my catheter and my bulb syringe ready for the site. Place that in my trash. It's actually a needle, but I'm not going to use it on my husband because just for demonstration purposes. So I'm going to pretend this is my needle, my catheter, and my so this is actually my needle going into my catheter. So I'll go back to the site, I will inspect it again and tap on the vein. Then I'll pull back the skin, and when I pull back the skin, I will position my needle at about a 45 angle into the patient's skin alongside the vein, and then I'll push about half an inch from the puncture site. And when I do that, I'll visualize the vein, then I'll reduce the angle to about 30. So as I do this, I'm going to push the catheter while retracting the needle. As I push the catheter, I will retract the needle into my I'll retract the needle into my syringe, and then I'll hold on the site. Then I'll take out this part that has the needle directly into my sharps container, and then I'll press down on the IV site to make sure there's no blood coming out. And this is so sticky. Let me use the paper one. So I'm going to put that down. And once I secure the catheter in place, I'm going to take out my tourniquet. Once I take out my tourniquet, release your fist. Now this is in place. I'm going to make sure that this place is covered as well, or directly with my already prepped or primed IV tubing. I'm going to go right here and connect the IV tubing. So since this one, let me see if I can put this. Yes, now it's connected. And as it is connected, I am going to draw some blood, and this is going to show me that the needle is in place. So first of all, before I retracted my needle, I was going to get a flash immediately I went into the skin. That will show me that I'm on a vein. Right now I'm doing the second testing to make sure I'm still on the vein. I'll retract it, and when I get blood flow, that still tells me I'm on the vein. So I'll push the saline slowly back into the vein together with the blood, and until that is done. And when I do that, I'm going to loop the tubing and secure it. You can see it's a little loose. I'm going to secure it in place so it doesn't come out. So that is well secured. Make sure it's okay, nothing is coming out. Make sure there's no leakage. There is, after flushing everything, there's no leakage. The site is, there's no redness, no swelling, no rash, no phlebitis. The place is now set. So as I have this on, I'm going to take out my saline lock. So when I take that out, I'm going to trash that, and then I'm going to use this as my cover. And the reason why we are covering everything is to make sure that there is no contamination, that germs doesn't get into their place. So I'm just going to demonstrate. I'm going to use that as my lock right there. So all of this is trash. Now, why it's like this, if I have any blood or any fluid around, I'm just going to clean it to make sure my patient is not like dirty of blood around. I'm just going to clean it and I'm going to throw it. In this case, I'll apply my tourniquet, because you know that's the transparent one. That was it. I'm going to apply it on top, and that's just to be able to see if the needle ever gets the catheter ever comes out of the skin. So I have my tourniquet right there, and then I'm going to place my label just by the side. Just going to place my label just by the side, and my label carries the date, time, the gauge needle that I used, and my initials right there. So I'm going to do that. Let's say it's going to stick there. Now after placing this label, I'm going to take off my gloves. in the trash. I'll wash my hands. I'll document the procedure, the location, which is this is the left hand, and how the patient reacted throughout the procedure. I'm going to document all of that, and then I will check again for the cannula and the infusion site to make sure there's no infiltration, no phlebitis, there's no compromised tubing or the cannula. All of this I'll be checking every 30 minutes during my shift to make sure that everything is okay. And then I'll make sure the patient is in a safe and comfortable position. That is, I'll make sure the bed is low in its lowest position and safe. The wheels are locked. And then I'll place call light within reach. And then I guess that's the end of this procedure. Now I'm going to be doing the priming of an IV. And here I'm just going to place the stuff that I'll need. Of course, I'll be needing a gauze pad. I'll be needing a tape. I think that's a few things that I'll be needing. I'll be needing saline as well, just to flush to make sure the IV is patent. I'll also be what else would I be needing? I'll be needing my tubing that will go in here. So I have my stuff right here behind me. So for me to do the priming, I'll get my supplies ready, just like I said, the little things that I'll need. And then first, before I start, I'll have to check the doctor's order. And then when I check the doctor's order, I'll have to ID the patient again. Of course, it's the same patient that I'm using, and since it's the same video, I'm just going to go ahead into the priming. So I'll check the IV fluid. I'll press on it to make sure that there are no holes, and then I'll compare the label to the physician's order to make sure that it's the correct label, and I'll check the tubing as well to make sure that is the correct size. So I'll need a label again for the IV that I'll have to check to make sure that everything is correct. And this label carries the start date, the discard date, and my initials. So I'm going to check the doctor's order of what kind of solution it is. And like I said, I'm going to inspect to make sure that it's not expired and it's not cloudy. All right. So now I have all of these. I'm going to be using this as my alcohol wipes. And then I'll also be needing this as gauze, just in case of any if any fluid comes out. And then I am going to be checking my extension tubing to make sure that there are no air bubbles. So after inspecting that is the right size, I'm just going to check it and make sure that it has the right length that is in the order and is the right size. So I'll put it there. It has a cover right here. Actually, this is not a real IV thing. It's a tube feeding hook that I'm using as my IV fluid. So now, before I start anything, I am going to inspect the site. So I want to make sure that this site, there is no bleeding. With this site, there is no bleeding, no swelling, no rash, and no bruises. So after I do this, I'm going to prime my tubing. I've already checked what drip factor that is. So I'm going to prime my tubing here. And how I prime my tubing, I'm going to do it just like I demonstrated before. So this is actually supposed to be separately, but I'll just consider that I'm priming it. So how I'll do it, I'm going to get my saline again. So here is going to be, I'm going to take this as my drip factor, and then it's 1 tube. Once this is supposed to be my tubing, and it has a spike that I'll take out the top of it. Consider that is here, and then I'll put the spike in there. Once I place the spike in there, before I do that, I want to make sure that it's clamped, because I don't want all the solution going out of the tubing. So I'll have to clamp it before I spike it. So when I clamp it, I'll spike it, and then it should have a roller lock. I was using something as my clamp. I can't find it anymore. Okay. I was using this as my clamp to just clamp the tubing so I don't have nothing going out of it. So when it gets here, this place is sterile, and so it has a plastic cup that covers it. I don't want to touch it with my hands. So actually I don't need this because I already have a fluid in here. So I'm just going to open it gently. When I open it gently, now I'm going to gently open. So I'm going to unclamp it. I'm going to open the clamp, and I'm going to use my roller clamp to open it gently. As it comes down, if I see any bubbles of water, I'm just going to hit it like that, and it's going to go down. When I see my IV solution getting into the drip chamber, then I know it's going down. So I'll let it go all the way to the tube, right to the end, and then I'll make sure I have some drips and there is no air or any space left in the tubing. And then I will clamp it, I'll roller clamp it and lock it. So right away I am going to lock this area. After I do that, I'm going to come to this area now where I have my cup. I'll take my cup out, and I'm just going to place my IV tubing just directly into the insertion site. And once I do that, it's locked already. Now I'm going to open it and see how it goes. If it goes, I want to make sure that my patient is not in any pain or there is no swelling, because any signs of swelling will tell me the IV is not in place or the catheter is not in place. Once it's like that, I'm going to tape it. So I'm going to let it run. Once it's running, I want to compare the infusion rate that I just set it to make sure that it's the same with the doctor's order. And once I do this, I'm going to check the site again to make sure that there is no swelling, there is no redness or inflammation at the site. And then this is going to be my priming. Now I'm going to take it out. So I'm going to be discontinuing the fluid. First, I'm going to gather my supplies. I'm going to wash my hands. I'll put on my gloves. I'll explain the procedure to the patient. and then I am going to turn off the infusion pump. So just like right where my roller clamp is, I'm going to turn it off. And once I turn the infusion pump off, I'm going to use my alcohol wipes. Well, I'm going to use my alcohol wipes to, just wet the skin, because some people's skins are sensitive. Just wet it like that. So I put it in the trash so that it's soft. When I pull it out, their skin is not irritated, or they don't have any skin tear. So I'm gently going to remove the tip. Sorry. You have a lot of hair. Okay. I'm going to gently remove the tape, all of it. So we have another tape. This one is not painful, yeah? So now I'll consider this as my tourniquet. So I am going to loosen the dressing just gently from the skin. Sorry. Gently, 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 gently. So I have to make sure I'm holding to this. So gently, gently. Now I have that. I have to hold on to it so it doesn't come out on its own. So after I have loosened the dressing, I am going to stabilize the catheter while I remove the dressing. That is why my hand is right here. So after I do that, I am going to remove the catheter gently, like keeping it almost flushed with the skin. So I'm going to just remove it like that without pressing on the skin. So gently. And there we have our catheter out. So I'm going to put that in my trash. And immediately after I do that, I want to use my gauze pads and place on the site, press down on the site, on the venipuncture side, and hold firmly for the blood to stop at least a minute. So after applying the sterile pad in place, I'm going to use my tape. I should have some here, just to hold it down on the venipuncture site. What a huge tip. Sorry, I tip your hair again. So I'm going to secure it like that on the venipuncture site until that blood stops. So I'm going to now elevate the patient's arm to, reduce venous pressure, and also to help collapse the veins, to help any collapsed veins to facilitate blood flow. So after this, I am going to observe the site again to make sure that there's no redness, no hematoma, no swelling. Now I'm going to dispose of my equipment that I have right here. Everything that I used, everything. I'm going to dispose of my equipment, and then I'm going to take off my gloves, and then I'll wash my hands. Then I'll be checking the site every 15 minutes while I'll record the volume infused on I and O sheets. So that's the end of my demonstration about IV insertion, IV priming, and discontinuing of IV. I hope you guys enjoyed it. Thank you. Bye.